So, what was the news you were so excited to tell me?
Well, I'm pregnant. Matt and I are having a baby.
Congratulations, that's great. How are you feeling? Do you have any morning sickness yet?
Don't jinx me. I remember how awful yours was with Anne.
I know. 9 months of morning sickness, 12 hours of labor, all the doctor's appointments, and the dentist.
The dentist? What does the dentist have to do with pregnancy?
Well, you know all the pregnancy hormones that make you crazy?
Yeah.
It turns out they make your gums crazy too.
What exactly do you mean by crazy?
Well, pregnancy hormones can really affect your gums, so it can make them red, really swollen, and irritated.
Well,
Thank you so much.
Do you have any advice?
Yeah, I would say, first of all, you need to make sure you go get a periodontal screening. That's when the dentist looks at your gums and gives you an overall checkup. Second, you have to keep up with your oral hygiene. I know that pregnancy's already tough, but you have to make sure that you're brushing and flossing daily. You can't slack. And third, if you're going to have to get any dental procedure, you need to make sure you get it done in your second trimester.
I guess I better make that appointment sooner rather than later.
Yes. So, what do you and Matt want, a boy or a girl?
There are many things to consider during pregnancy. Here are 6 tips for dental health during pregnancy. Number 1, be diligent about your oral hygiene. Number 2, see your dentist. Number 3, ask questions. Number 4, educate yourself. Number 5, plan ahead. And number 6, find affordable dental care.
Hello, Elaine.
Hello.
What brings you to the office today?
Well, my husband Matt and I are having our first baby.
Well, congratulations.
Thank you. I'm about 3 months pregnant, and I was speaking with my friend Carol, and she recommended that I come over to see you as soon as possible.
Well, it sounds like Carol knows what she's talking about. So what do you know about pregnancy and oral health?
Not much. I was hoping you could give me more information on the specifics.
Well, you've definitely come to the right place. Well, I'm sure you're aware of how pregnancy hormones can affect your mood and appetite.
Yes, of course.
Well, just as they can affect your appetite, they can also affect your oral health. You're at an increased risk of gingivitis, or simply put it, you're at increased risk for having inflammation of your gums.
So what happens when I have gingivitis?
Well, Elaine, visually you can see swelling, redness, and bleeding of the gums. Sometimes a bad bacteria or plaque, also known as dental bugs, can react badly with the swollen gums. When this occurs, you're at an increased risk of having pregnancy tumors.
Pregnancy tumors? Like cancer?
Not quite, Elaine. They're generally non-cancerous and painless. They sometimes do require surgical removal and have a tendency to reform.
So when am I at risk for all this?
Generally, starting about the 2nd or 3rd month of pregnancy, you're at an increased risk, and it generally continues till about the 8th month of pregnancy.
No wonder Carol recommended I get over here as soon as possible. Well, can we do the exam today, but could I also schedule an appointment for next week? I'd really love my husband Matt to know more about this.
That's perfect. We'll start with the exam today.
There are 2 main hormones that affect pregnancy: estrogen and progesterone. These hormones can increase a woman's susceptibility to gingivitis and inflammation. The effects of these hormones typically start from the 2nd or 3rd month of pregnancy and can progress to the 8th month of pregnancy. The gums typically look red, swollen, tender, and can bleed at the slightest touch during brushing and during flossing. Debris in the mouth can make matters worse. In some women, P. gingivalis, or simply known as the main pregnancy oral bug, can cause tumors to form in the gums. Women with periodontal disease may be 7 times more likely to have a baby that is born too early and is too small.
Hey, so, how's my pregnant wife and growing son doing?
You know, it could be a little girl.
Oh, it doesn't matter to me as long as both of you are healthy.
Speaking of healthy, I just came back from Dr. Smith's office.
You did? How'd that go? Did you make a second appointment so I could talk to him too?
Of course. I never knew how important my dental health was during pregnancy. But wait a minute. I thought you said you had a dental phobia.
I do. I'm scared to go out like one of the dentists.
Well, I don't mind it. Maybe I can give you some advice.
Oh, I love how my pregnant wife is the one comforting me right now. But yes, please give me some advice.
There have been many advancements in dentistry. I mean, a lot of procedures can be rendered painless by a simple injection now. And if you're still nervous, you can just tell the dentist and he can walk you through the process step by step. Sometimes taking the mystery out of dentistry can make it more comfortable.
Oh, I guess I can understand that. And person avoids going to the dentist, the problem could become worse.
Prevention is key. By making this appointment now, I'm ensuring good dental health and preventing further problems from developing.
And imagine, the only thing I thought we had to worry about was the mood swings, the morning sickness, and the food cravings.
Speaking of food cravings, do we have any pickles?
You know how much I love you. But yes, I do agree with you 100%. We both need to practice good oral hygiene and excellent oral health.
And maybe ice cream. I'll brush my teeth.
Dental appointments are especially important for pregnant women. Prevention is key. The more you know about pregnancy and dental health, the more equipped you are to handle issues that arise during the course of your pregnancy. If you are feeling anxious about going for a checkup, let your dentist know. Ask your dentist to explain each step of the procedure. By knowing more about the procedure, you can feel more comfortable during the appointment. And remember, there have been many advancements made in dental pain management over the years.
Dr. Smith, thanks for seeing us today.
Of course, it's my pleasure. Congratulations to the both of you.
Thank you. Dr. Smith, I've still been wondering about pregnancy tumors. If they're not cancerous, then what's the cause for concern?
That's a very good question, Elaine. Well, as you can imagine, gingivitis is an infection, and generally infections are a cause for concern during pregnancy.
Well, what are some of the problems associated with gingivitis?
Gingivitis causes periodontal or gum infections, and research has linked periodontal and gum infections to babies being born preterm and babies being born with a low birth weight.
Wow, I didn't know any of that. I'm definitely glad I came today. What are some of your recommendations?
Well, the number one thing is to try to keep the bacteria count low in the mouth. To do this, we recommend you brush and floss daily. It is amazing to see what good oral hygiene can do.
But Dr. Smith, what if I need a filling or some other dental work? When should I do that?
Well, Elaine, generally we recommend you leave all elective dental procedures off till after pregnancy. However, if a dental procedure needs to be done, it can be done during the second trimester or even sometimes during the third.
Well, thank you for seeing us today, Dr. Smith.
It is my pleasure. Please feel free to make as many appointments as you guys need. I'll be more than happy to help you guys in this journey.
Gingivitis affects 60 to 75% of pregnant women. Gingivitis is more than just swollen, red, and bleeding gums. It is evidence of infection in the mouth. Your infected gums harbor bacteria that produce toxins, which attack the ligaments and bone around your teeth. Think of gingivitis as an infected wound in your mouth. This infected wound provides access to your blood, which can travel throughout the body and into your unborn baby's body. During pregnancy, it is important to maintain your regular dental appointments and cleanings. This will help prevent gum infections. But major elective dental procedures should not be performed until the baby has been born. Expecting a baby is a very exciting time, and you're already on the right path by staying on top of your dental health. By being proactive about your dental health, you'll increase your chances of having a smoother pregnancy, full-term delivery, and a healthy baby.